Dr. Suganya, Assistant Professor, Department of General Surgery. I have 8+ years of work experience. I am a member of Indian Medical Association, a member of FIAGS and member of FAC-RSI. The topic for today is wound. So definition, wound is a break in the integrity of the skin or tissue, often which may be associated with the disruption of the structure and the function. Wound is simply a disruption of any tissue. It could be a soft tissue or a bone or any internal organ also. Ulcer is one type of wound. Classification of wound has many classification, and first classification is the rank and the Wakefield classification. According to rank and Wakefield classification, wound is divided into tidy and untidy wound. Tidy wound, these are wound like surgical incision and wound caused by sharp object. It is incised, clean, healthy wound without any tissue loss. Usually primary suturing is done and healing is by primary intention. Untidy wound, these are due to crushing, tearing, avulsion, devitalized injury, vascular injury, multiple irregular wounds or burns. Fracture of any underlying bone may also be present. Second classification based on type of wound. It is clean incised wound. It is a tidy, simple, clean cut wound with linear cut edges, usually due to sharp objects like blade, glass piece or knife. It is also treated by primary suturing. Second is the lacerated wound. It has ragged edges with some part of tissue getting devitalized. Viability of the tissue may be impaired, depth of the injury and tissue damage should be carefully assessed. Proper adequate wound excision, thorough warm saline wash and suturing of wound layer by layer is required. Bruise or contusion. It is due to blow or blunt force in the skin or tissue underlying wherein the blood vessel or capillary are damaged underneath. There is a skin discoloration without breaking the skin. Broken vessel causes seepage of blood underneath. The next is the hematoma. It is the localized collection of blood after blunt trauma or after injury. Collected fluid blood gets clotted in few minutes to hours. Later eventually it liquefies to form a discolored fluid. Large hematoma may get infected to form an abscess. So it always requires an incision and drainage under regional or local anesthesia. Small hematoma usually gets absorbed like scalp hematoma. Often hematoma contains reddish plasmatic fluid which should be aspirated using wide bore needle. Abrasion. It is a superficial injury, could be a scratch, grass, pressure or contact, and it is due to shearing of the skin where the surface is rubbed off. This tangential force causes loss of epidermis, exposing the dermal vessels and nerves, leading to profuse painful oozing. Abrasion heals by epithelialization. Any dirt or foreign body on the abrasion should be removed to avoid formation of a poor tattoo-like scar. Next is the punctured wound and the bite. It is usually a stab wound with a pointed object. Here the depth of the wound is more than the width. Deeper vital structures or organ may be injured, so should be assessed. Foreign body or any object may be present in the depth of the wound should also be removed. Wound should be exposed under general or regional anesthesia to assess the depth and the severity of injury, and suturing layer by layer after a thorough saline wash should be done. Penetrating wound. These are similar to punctured wound, occur to stab. Abdomen and chest are the common site. Liver, bowel, spleen, major vessel and other visceral organ may be involved. Ultrasound and CT scan should be done to evaluate the deeper organ structure. Under general anesthesia, wound should be explored properly and proper treatment should be given. Traction and avulsion injury. These are complex injury where the tissues are displaced from their normal anatomical position and the alignment. After initial resuscitation, definitive treatment like skin graft or nerve repair should be done. Crush injury. It is due to major wound, war wound, natural disaster like earthquake injury, tourniquet injury. It leads into compartment syndrome, muscle ischemia, loss of tissue, gangrene or sepsis. Muscle will lose its viability, which is identified by its color, lose its contractility, become turgid and will not bleed on cutting. So gunshot injury. These injury may be superficial or deep. Usually entry wound and exit wound will be present. It causes explosive and destructive injury along with the burn injuries in the deeper plane and the organ. It can be high velocity injury with massive bleeding and major organ injury. Injuries to bone and joint. It is common in all major injuries, should be identified clinically and confirmed radiologically. It needs specialized management like reduction, plating or etc. Injuries to nerves, arteries and vessels. It could be a major vessels also or deeper organ. It needs initial resuscitation, later staged management as per individual patient basis depending on the severity and the extent of injury and the loss of function. Closed blunt injury. It may be due to fall or blunt injury wherein no obvious external injury is seen, but deeper injury can occur. It may often severe enough to cause major injury like blunt abdominal injury causing bowel, liver, spleen or renal injury. Third classification is based on thickness of wound. It could be a superficial wound involving only the epidermis and the derminal papillae, or partial thickness wound where the skin loss up to deep dermis will be present. Full thickness wound with loss of entire skin and subcutaneous tissue causing spacing out of skin edges. Deep wound or the one extending deeper across the deep fascia into the muscle or the deeper structure. Complicated wounds are one associated with injury to vessels or nerves, and penetrating wound is one which penetrates either into the natural cavity or the organs. Classification based on involvement of structure. It could be a simple wound or complex or combined wound. Next is the classification based on time elapsed. It could be an acute wound or it could be a chronic wound. Acute wounds are generally defined as those that progress through the normal phase of healing and typically show signs of healing in less than 4 weeks. Examples are the surgical or traumatic or burn wound. A wound is considered chronic if healing does not occur within the expected period according to the etiology or localization. Chronic wound can be classified as typical and atypical wound. Then we have to know what is a biofilm. Biofilm is a complex structure of microorganism contained in the extracellular matrix of protein and polysaccharide that adhere to the surface, creating a protected environment for the organism. So for any wound, chronic wound or any wound to heal, we have to always remove the biofilm. Next is the classification of surgical wound, which is the Berard wound classification. According to this classification, it is divided into clean, contaminated and the dirty wound. So what is a clean wound? Elective, primarily closed, no entrance of normally or frequently colonized body cavity, no break in the sterile technique. Examples are the inguinal hernioplasty or any hernioplasty, and also thyroidectomy. Infective rate is very less than 2%. Clean contaminated wound, controlled opening of normally colonized body cavity, minimal spillage or break in the sterile technique. Infective rate here is up to 30%. Example is the appendicectomy. Contaminated wound, acute inflammation, break in sterile technique, spillage from hollow organ, penetrating trauma less than 4 hours from injury. Examples are the acute abdominal condition. Here the infection rate is up to 60%. Dirty wound, purulent abscess, perforation with colonized bacteria, penetrating trauma more than 4 hours from the injury. Examples are the abscess or perforated viscous with peritonitis. Here the infection rate is up to more than 60%. So coming to wound healing. Wound healing is a complex process to achieve anatomical and functional integrity of disruption tissue by various components like neutrophil, macrophages, lymphocytes, fibroblast, collagen in an organized staged pathway. What are the stages of wound healing? First is the stage of hematoma and inflammation. Stages of granulation tissue formation and organization. Here, due to fibroblastic activity, synthesis of collagen and ground substances occur. Stages of epithelialization, stages of scar formation and resorption, and stages of maturation. And what are the types of wound healing? There are 3 types of wound healing: primary healing, secondary healing, and healing by third intention. So what is primary healing? Which occurs in clean incised or surgical wound. Wound edges are approximated with suture. Healing occurs mainly by epithelial regeneration with minimal fibrosis. Secondary healing by intention occurs in wound with extensive tissue loss. Example is trauma, burns or any infected wound. Heals slowly by granulation and fibrosis. It results in a wide hypertrophied and contracted scar which may cause disability. Healing by tertiary intention, it occurs after the wound debridement and control of local infection. Wound is then closed with suture or covered with a skin graft. It is common in contaminated or mixed tissue wound. What are the factors affecting wound healing? There are local factors and the general factors. So presence of any infection will always delay healing by causing the tissue damage and inflammation. Presence of necrotic tissue or foreign body impairs the granulation and again epithelialization. Poor blood supply reduces the oxygen and the nutrient delivery. Venous or lymphatic stasis causes edema and poor tissue perfusion. Tissue tension may lead to wound edge separation, and presence of hematoma acts as a medium for bacterial growth and delays the wound healing. Coming to the general factors, old age, obesity, smoking, alcohol, stress will reduce the healing efficacy. Malnutrition, also lack of any essential nutrition, also slows the wound healing process. Mineral deficiencies like zinc, copper, manganese deficiency affects enzymatic activity in the collagen formation. Vitamin deficiency like vitamin C and vitamin A deficiency will impair the collagen synthesis and ultimately impair the wound healing. Anemia and hypoxia will delay the wound healing. Malignancy can also delays the wound healing. Uremia, jaundice, diabetes and other metabolic diseases, HIV and other immunosuppressive diseases, steroid, cytotoxic drugs and neuropathies are the other causes which will reduce the wound healing. Coming to the management of wound. Assessment, first you have to assess the wound. Assess whether it is a minor or the major wound or whether it is an acute or chronic wound. Evaluate the number, extent and depth of the wound. Check for any major organ involvement and the anatomical location. Measure wound in 2 dimensions, length into width, or 3 dimension like length, width or the depth. Take a detailed history of how the wound injury has occurred and whether it is associated with any pain or bleeding. Wound cleaning. Aim to optimize wound healing and prepare the wound bed. Follow aseptic precaution during the cleaning. Irrigate with warm saline, isotonic normal saline using a sterile syringe. Cleaning should be gentle to avoid disruption of any granulation tissue. Use neutral pH, non-toxic cleansing agent. Avoid delipidizing agent, antiseptic or alkalinating soaps. Coming to the specific treatment, for minor wound, you have to clean thoroughly with saline, apply a non-sticky dressing. Incised wound should be treated by primary suturing. Lacerated wound, excise the wound edges and then close by primary suture without any tension. Coming to hematoma, you can apply for ice packs wrapped in cloth 15 minutes every 2 hours for 24 hours. Use compression bandage and elevate the affected part. If persistent, you can do an ultrasound guided aspiration or evacuation. Coming to the crushed or the devitalized wound, you have to remove all the devitalized tissue, allow edema to subside which will usually take 2 to 6 days, then perform delayed primary suturing. If deep wound, allow complete granulation before closure. Secondary suturing after 10 days using monofilament non-absorbable suture. For wide wound, you can cover with split skin graft. For major wound, maintain airway and control bleeding. Start IV fluid immediately. Manage in operating theatre under general anesthesia after the full assessment. Other essential management, you should always start with appropriate IV antibiotic and IV fluid. You have to transfuse blood if there is severe anemia. You also have to correct electrolyte imbalance if there is any. You have to always give tetanus prophylaxis. Tetanus toxoid injection IM can be given, and critical care monitoring for any major trauma cases should always be done. Coming to the wound debridement, liberal excision of all devitalized tissue until a healthy bleeding vascular wound is achieved. It may be done in stages at interval. Sometimes it requires blood transfusion due to blood loss. The types of debridement include surgical, sharp, autolytic, enzymatic, larval or mechanical debridement can be done. A thorough wound debridement is the ultimate goal for any wound healing. So that brings to the end of today's lecture. We'll meet in some other interesting topic.